My name is Lisa Boss. I'm an assistant professor at the UT Health School of Nursing, and I thank you for your interest in the topic of caring for the elderly person with diabetes. The objectives for this presentation are to be able to define diabetes, to list clinical manifestations and complications of the disease. You'll be able to discuss an insulin reaction and also the clinical manifestations associated with that, describe diabetic ketoacidosis and the clinical manifestations, describe nutritional needs for an older adult diagnosed with diabetes, and list activities of care for the older adult diagnosed with diabetes. Okay, so we will start with a diagram of the pancreas, which is the center, the control center for the root causes of diabetes. So diabetes occurs when the pancreas produces too little insulin, and that would be diabetes type 1. Or when the body does not properly use the insulin that is secreted by the pancreas, and that would be diabetes type 2. So the part of the diagram that is the pancreas is the yellow portion, and it's right there next to the small intestine in your abdomen. The prevalence of diabetes, it is quite common in Americans. 29 million Americans, or 9% of the population as a whole, so that includes children through elderly, have diabetes. Of those with diabetes, only 21 million are diagnosed, so that means 8 million people don't even know they have diabetes. In older adults, 25% have diabetes. And that would be older adults that are 65 and older, and that includes diagnosed and undiagnosed. So those numbers, when you think about how many older adults there are, those numbers are quite large. In the year 2000, there were 35 million elderly. So that would mean 9 million have diabetes. And then in the year 2030, it's projected that there are going to be 71 million elderly. So that would mean almost 18 million of them have diabetes. So this is a big problem now, and it's going to continue to be a very big problem. The most common risk factors for diabetes are family history, being obese or overweight, age, so it's more common as we age. And then there are two types, as I spoke about before, type 1 and type 2. Diabetes type 1. This is the one that you might recognize the term juvenile onset. That's the older term. The more common term is diabetes type 1. This is the one that we see in children and young adults. So it starts at a very young age. And this is where the pancreas does not produce any insulin whatsoever. So at some point in their childhood or very young adulthood, the insulin stops being secreted from the pancreas altogether, and it's not reversible. When this happens to somebody, it will be permanent for the rest of their life. So these are the people that you know that at a very young age they get insulin injections, or more recently, most of the kids that have this have an insulin pump. So that way the insulin is just constantly secreted in small amounts based on the blood sugar. They are very strict in terms of their dietary management. They're taught from a very young age what they can eat and what they should avoid. They take finger stick blood sugar monitoring several times a day. And they're encouraged to have regular exercise because that will naturally help keep the blood sugar from rising excessively. And this occurs in 10% of all cases, so it's definitely the smaller number of cases that are diabetes type 1. What you will most likely see as you care for the elderly are the diabetes type 2. And the other term for this is the adult onset, but the medical term would be diabetes type 2. So this is where the pancreas doesn't produce enough insulin, so it still produces some insulin, but it might not be enough, or the body doesn't properly utilize it. It's insidious, and that just means that it develops gradually, in contrast to type 1, where it might be just one day, all of a sudden they're very sick with diabetes. This develops very gradually, and it can take years to gradually develop, and their symptoms finally get to a point where it becomes obvious that they have diabetes type 2. It's a milder form of diabetes, and that's typically because the body still does produce some insulin. So they don't typically have to take insulin injections. They are usually able to get by with pills, although some of them do have to take the insulin injections. It occurs in the older adults, and it definitely increases your risk as you get older. And it's most common in people that have a history of diabetes type 2, especially those who are overweight, obese, and physically inactive. And this is 90% of all diabetes diagnoses are type 2 in the elderly. So this is definitely the one that you will see the most and that you will have the most experience with. So when I said that it was insidious, that meant that it develops gradually. So people that end up developing diabetes type 2 are in the stage of pre-diabetes, and that can be for several years. So as it says here, almost 80 million adults are pre-diabetic, and that's a big number. But this means when they're in this state that their blood glucose levels are above normal, but not at the level for diagnosis of diabetes type 2. So they probably don't know that something is problematic with their blood sugar because they might not have major symptoms. But the problem is at this stage, they still can have cellular damage in their heart, their circulatory system, their brain, and their kidneys. So it is beneficial for them to find out that they're in the pre-diabetic stage, because there are interventions that can reverse it at this point. And the way they would find out would be to go to their doctor for a regular checkup, and the doctor draws routine blood work, and that's how you would find out. So lifestyle interventions they can do at this point, if they're pre-diabetic, to reverse the process would be to eat better meals. So that would mean a diet low in saturated fat, sugars, refined carbohydrates, as well as low sodium and overall total calories. If they would exercise, so that would mean 45 minutes a day, at least 5 times a week. And if they would reduce their weight by as little as 5 to 10%, they could have a significant impact on their overall health in this pre-diabetic state. Now, the problem with that is if they have any physical disabilities, it's hard for them to do exercise, and especially 45 minutes a day, 5 times a week. So you might have to help them come up with something that they can do, even if it's sitting in a chair, some sort of physical activity. There are clinical manifestations or signs and symptoms that you could be looking for as a formal caregiver that would be considered signs of diabetes. And all of these symptoms are due to the high sugar level in their blood and the associated damage that it causes. So they're going to be excessively hungry and thirsty, frequent urination, and there might even be glucose or sugar in the urine. They would have unintentional weight loss, elevated blood sugar, and that can be detected with just a little finger stick blood sugar. Vision changes, so when you have high blood sugar, you could possibly have blurred vision. So if something happened pretty quickly, if that was a common or quick change, that might alert you. They could have tingling and numbness in their hands and feet. They're tired most of the time, and it's because they have all this sugar in their blood, and they could have very dry skin. So some of these symptoms you might not notice as being too unusual, like dry skin. It's not uncommon for elderly to have dry skin, but when you put several of them together, if they have several of these symptoms, then it might cue you in that we need to maybe check the blood sugar or let somebody else know so that someone can explore it further. The biggest problem, long-term problem with diabetes is damage to the blood vessels. So that's the blood vessels in your heart, in your brain, as well as your limbs, so your arms and your legs, and then your other major organs, your kidneys. And that would increase your risk for specifically heart attack and stroke. Poor circulation to the extremities, so that's, if you've heard of diabetics, they have foot ulcers. It's because of the long-term effect of the high blood sugar that causes poor circulation and blood to get to their feet. Poor wound healing, so it's very important that they keep their skin in good health, because if they get an infection and they don't have a good blood supply to the wound, then they're at high risk of having gangrene or ultimately having to have that limb amputated. Also, kidney damage that could result in kidney failure, and that's when you see diabetics on dialysis. It's because of the high blood sugar. The nerve damage and nerve pain in the arms and legs, and then it also damages the blood vessels in your eyes. So that's why you may have heard of diabetics that they're blind, and it's because they can't see related to the high blood sugar that's damaged the blood vessels in their eyes. There are signs and symptoms that you can pick up on and report to the nurse immediately if you see any of these. Typically, you might find something in their skin, so it would be very advantageous for you to examine their skin, especially in their feet and toes, because that's something that they might not be able to see. As they get older, they might not be able to bend down or bring their feet up so that they can see their feet and toes. And that might be something, they might have an ulcer or a little tear there that they don't know about. So it would be helpful for you to find that for them, and then you can alert the nurse, and then it can get taken care of before it gets out of control. But in addition to them not being able to see their feet and toes and examine for themselves if they have a problem, they might not be able to feel it. So I have heard of stories where they might walk around in their house and they might step on a nail and they don't even know it. So then they could even have the nail still stuck in their foot, or even if they just step on something and break the skin, they don't know about it, they can't feel it. So it's important to always look at that for them, and as well as encourage them to wear shoes at the house or whenever they're walking around to protect their feet so that they don't get any sort of breakdown. Their appetite, you might notice that they might eat too much or too little. They could have excessive thirst, they could have nausea, vomiting, unintended weight changes, or sweet, fruity breath, and that's just another result of having high blood sugar. It makes your breath smell sweet or fruity. That's not anything I've ever smelled personally with patients, but I think it's just a part of the picture. So if they just had that by itself, it might not mean anything, but if they have that with other symptoms, then it should cue you in that maybe we should check the blood sugar, or definitely report to the nurse and go from there. They could have a change in their urine output from being dehydrated or from drinking too much. So it could be a lot or a little, but a change, that's what you're looking for. Something that's different than it normally is for that patient. They could have a change in their mental status, so they could be irritable, agitated, or nervous. They could also be very lethargic and even go into a coma, and that would be the result of either high blood sugar or very low blood sugar. So again, it's a change. It's something that's different than it was before, and that's something that you could pay attention to. A change in vision and change in mobility. These are all signs that you should notice and be alert to and make the nurse aware if you notice. Something else that can happen to somebody who is a diabetic and someone who is on insulin is that they get too much insulin. So what happens then is they get too much insulin, which makes their blood sugar drop too low. And so that would be called hypoglycemia. So something that you should always think about is if they're getting insulin, for example, as part of their breakfast medication, they should most likely never get that insulin unless they're going to eat with it. So in the hospital, we make sure that the trays are all delivered from the cafeteria even before we give the medication, because we don't want to give the insulin and then for some reason there's a big delay in the food coming up, and then in the meantime their insulin drops. So we make sure that we don't give the insulin until we actually put the tray in the room and we know that the patient's going to eat it. And then you also need to monitor that they do eat the food, because if you give them insulin and they don't take anything by mouth, not even any sugar, juice, or drink, then most likely their blood sugar will decrease. It also happens if they've had too much exercise and not enough food. So that is something to think about, although I don't think it's the more common situation. The more common situation is that they're going to have insulin and not enough food. They could also become hypoglycemic if they have vomiting and diarrhea. So that means they most likely have something else going on that's causing the vomiting and diarrhea. So sometimes in that situation, if they already have the vomiting and diarrhea, the nurse or their doctor might not give the insulin. So it's something that you need to be aware of. If you know they've had vomiting and diarrhea, make sure that the nurse and everybody else on the team are aware so that they don't get this medication and they don't get too much insulin and then end up with low blood sugar. The signs and symptoms of the insulin reaction, which would be hypoglycemia, would most typically look like weakness and trembling. They might tell you that they feel strange or they feel different, and they might not be able to say exactly what, but just that they don't feel right. They feel different. They might feel nervous or irritable. That's how they might act. They might actually complain of dizziness and fainting. They could become unconscious. They could be sweating, so you would notice on their face and on their upper chest that they're wet, and it's from being sweaty from the low blood sugar. They don't have enough blood glucose to feed their cells, and this is what the problem is when they have insulin reaction. So what needs to be done immediately is to give them food that has sugar and it's rapidly absorbed. That would be a lump of sugar, a hard candy, or an orange juice, or any kind of juice. The main thing to think about that though is safety. So if they're unconscious or if they're kind of going in and out of fainting, you wouldn't want to put anything in their mouth that they could choke on. So if they're alert and awake enough to swallow something safely, then that would be the easiest and best thing to do first. If you don't think, or there's any question that they could choke and they couldn't swallow something, then definitely you would never put anything in their mouth, even a drink. So in that case, the nurse would have to collaborate with the doctor, and you could give them, or they could give them something in their IV blood sugar that way. But think about how they look and what would be the most reasonable plan of action based on if they could swallow or not. But anytime they have these type of symptoms or anything close to that, definitely the nurse and the whole healthcare team should be alerted, and then everybody can assess the patient and decide what the best plan of action is. You should also think about what you could do also at that time would be, if you have access to it, to check the blood sugar. So that would help the team know for sure what the blood sugar is and where they should go from there. So the opposite of the insulin reaction, which is hypoglycemia, would be diabetic ketoacidosis, which is hyperglycemia. So this means there's not enough insulin and their blood sugar can go very high. Risk factors for this includes diabetes that's not diagnosed. So essentially you have diabetes and you're not being treated for it. So at some point the blood sugar is going to be so high that it's going to cause you to have symptoms. If they go without insulin or they don't take their medication, so for whatever reason, whether they don't have access to it or they can't afford it, they're not taking the insulin. Overeating, so they decide that they want to eat pie and cake and candy and Coke, and ultimately the result would be high blood sugar. They don't exercise. Another very common cause would be infection. So the elderly are prone to certain infections like urine infections and pneumonia, and they don't treat it. They're not on antibiotics, and so the body's response is a stress response, and that causes high blood sugar. And right here where it says stress, physical and or emotional. So any physical stress as well as emotional stress can cause high blood sugar. So even in the hospital, when we find out patients have high blood sugar, it's almost always a part of the conversation or part of the assessment to ask them, are you stressed about anything? Or to test their urine to see, do they have a bladder infection? Or do they have a lung infection, just because we want to find out maybe that's the reason why they have high blood sugar today. So it's definitely a part of the big picture, and you should think about all the different potential causes for it. Signs and symptoms of the high blood sugar would be, some of them are similar to the low blood sugar, which would be nausea, vomiting, excessive thirst, excessive urine. They could have abdominal pain. Their breathing could change and become labored and deep. They could become confused. They could have lethargy, so they could be very lethargic or stuporous, and they can even go into a coma. So, unfortunately, these symptoms are kind of similar to the low blood sugar, so that's why it's something to think about, that you should maybe check the blood sugar when you find out, you notice some of these symptoms, so that the team would know, okay, we have low blood sugar, or no, we have high blood sugar, and then the team can decide the best way to treat it at the time. There are dietary requirements that diabetics should adhere to, and you might be familiar with them. It is similar to what I spoke of earlier when I talked about a diet that's low in saturated fat, low in sugar, low in refined carbohydrates, as well as limiting sodium and their overall calorie intake. It would also benefit them in terms of their whole health to become active physically, and there are the challenges that you might have to deal with based on their physical disability, and then overall lifestyle. So they should not just do any changes for the short term. This really needs to be something for the long term, because there is the potential in many cases to reverse the type 2 diabetes mostly if it's because of overweight or obese. So it's definitely something that should be a long-term solution. There are specific foods of what to avoid for someone who's diabetic, and basically what that is anything that's high in sugar. So candy, ice cream, cakes, cookies, jelly, jam, fruits that are canned in heavy syrup, soft drinks, and alcoholic beverages. And the problem is these are the type of foods that are so easy for people to get. They're very cheap. They last a long time on the shelf or in the refrigerator. So it's somebody like the elderly who might be on a fixed budget and have limited access. These are the type of things that are easy for them to store and keep for a very long time, but on the other hand, it's the worst thing that most likely be eating. So you have to work with them and help them figure out ways to have access to better choices. And that's mostly going to be things that are fresh vegetables, fresh fruit, dairy products, and then protein that would not cause their blood sugar to be elevated. For most diabetics, the plan of care would be similar to these guidelines, and that's going to be for them to adhere to their diabetic diet for the long term, for them to have portion control along with salt and fat restrictions, for them to participate in a daily exercise program, for them to adhere to the medication treatment plan, whether that's insulin injections or the insulin or the oral medication in the pill form. They need to keep regular appointments with their healthcare provider, and the reason for that is the healthcare provider will draw blood at certain intervals throughout the year, and they can test to see if the diabetes is under control or not. So it's a good gauge to know whether they've been eating the way they should or they've been doing what they're supposed to be doing. The blood test will give you a very good answer on that. And then the good foot care. Like I said before, that's very important because they often don't feel when they have an ulcer or when they have a problem on their foot. They just don't know. And it's hard for them to see just physically that aspect of their foot. So it's very important if somebody else can look at that for them on a regular basis and encourage them to always wear some sort of foot device, whether it's slipper or something that won't cause them to trip, but some sort of house shoe or something comfortable all the time, even in the home. And here's your references if you would like more reading.